You're watching this video because a doctor wants you to understand what's involved in insertion of a ventricular pleural shunt. Cerebrospinal fluid, or CSF, can build up in the brain and cause the pressure inside the head to increase. This is called hydrocephalus. The aim of this operation is to divert the fluid away from the brain. It's typically done under general anesthesia, also known as being put to sleep. Some of the hair will need to be cut or shaved to prevent infection getting into the wound. Where this will be and how much hair is removed will vary depending on the personal requirements of your operation. Sometimes 3D computer technology, like satellite navigation for the brain, is used to help the surgeons during the procedure. The surgeon will make a cut in the skin of the scalp. It's usually a C shape. Special drills are used to make a hole in the skull. They're designed to stop if they reach anything soft. There will also be a small cut in the side of the chest. The position of the incision and hole will vary depending on your personal requirements. The surgeon will then assemble the shunt. A shunt is a thin tube that drains away the extra CSF from the ventricles of the brain to the chest where it's absorbed. There are usually 3 components to a shunt: a thin tube that drains fluid away from the brain, another which drains fluid into a cavity where it can be absorbed, and a valve in the middle. The valve controls the rate of flow of the fluid, and it can be programmable or fixed at a certain pressure. There may be other components that help control the flow of fluid too. The surgeon will then insert the tube into the fluid space of the brain. The rest of the shunt is tunneled or passed under the skin to the chest cavity. To finish, the surgeon will close the scalp and chest with sutures or staples that may need to be removed at a later date. The healing process will fill some of the hole in the skull, but there may be a permanent small bump that you can feel. There may also be a bump where the valve is. These are usually, but not always, covered up by the scalp and hair. There will be 2 wound dressings, and a head bandage may be applied as well. Please ask your surgical team for your personal post-operative plan after the procedure is finished, so they can give advice based on your needs. When considering whether to have a procedure or treatment, you should consider the potential benefits, the potential risks, and whether there are any alternatives available, such as medication, waiting longer, or even not doing anything at all. You should take time to ensure you've considered all of this carefully. Between 1 in 5 in every 100 patients suffer from minor or treatable complications from the surgery, such as shunt blockage. If any component of the shunt becomes blocked, the fluid and pressure may build up again in the brain. Further surgery may be required to explore and change any part of the shunt that's problematic. Overdrainage or underdrainage. If it underdrains, then the symptoms may continue. If the shunt drains too much fluid, it can give headaches and rarely cause bleeding on the surface of the brain. The pressure settings of the shunt valve may need to be adjusted occasionally to find a pressure that works well. This is easily done as an outpatient by placing a special device on the scalp while awake and takes just a few seconds. Infection, which is when bugs get into the wound, you may need antibiotics to treat it. Bleeding or bruising. You may get a black eye if the bruising travels downwards. This usually resolves on its own over a few weeks. Seizures or fits, which are a sudden, uncontrolled electrical disturbance in the brain. It can happen because of irritation to the brain during or after an operation. It's treated with medication that can reduce seizure activity. Headaches. Some people suffer from these after surgery. This is often temporary, but it may, unfortunately, be permanent. CSF or cerebrospinal fluid leak, which requires you to stay in the hospital slightly longer to ensure it heals up before you can go home. If it doesn't stop on its own, you may need another operation to fix it. Pressure on skin, nerves, or eyes. Problems with positioning during the operation. which might include pressure problems, skin and nerve injuries, and eye complications, including, very rarely, blindness. Special gel mattresses and operating tables are used to minimize this. More serious and sometimes untreatable risks include stroke, which is a type of brain damage. Brain surgery can cause strokes in up to 5 out of 100 cases, but can be higher depending on the area of the brain being operated and the abnormality. A stroke can lead to weakness, paralysis, problems with sensation, speech, memory, vision, concentration, or personality changes. If it's a large stroke, you may not wake up properly. The changes you experience will depend on the area of the brain affected. Different parts of the brain have varying functions and importance to your ability to live your life normally. There's no medical treatment that reverses a stroke. However, in some cases, the brain forms alternative pathways to help overcome the problems caused by it. If you suffer a stroke, you may require a prolonged period of rehabilitation at a rehab center or even at home. It may significantly affect your ability to work and live your life fully. Damage to internal organs. This rare complication can occur during tunneling or while internalizing the shunt tubing. It's possible to cause injury to organs, including the lungs, blood vessels, intestines, or abdominal organs. Medical or anesthesia complications, such as blood clots in your legs or lungs, which may affect your breathing, heart attack, and other medical or anesthetic problems can occur. Death. Rarely, death as a result of damage to major blood vessels or vital brain structures. If one of these uncommon risks turns into a complication, extra procedures may be required, such as a blood transfusion or further surgery. Thankfully, for most patients, there'll be no complications. You'll be encouraged to mobilize as soon after the procedure as you can. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team.